As usual, before I start, I'm repping It Is What It Is, Stochi's shirt. Brand ambassador unpaid though. So, ladies and gentlemen, good evening. My name is Dr. Chain Akano. As you know, today's topic is asthma and asthma deaths. So, asthma is not an unusual or unfamiliar disease. I'm sure a lot of people, there's hardly anybody who's online who hasn't heard about asthma before. So, but before I start discussing asthma, I want to make a distinction between the what we know as asthma, which is the bronchial asthma that happens, bronchial asthma, and another form of asthma known as cardiac asthma. Cardiac asthma happens when your heart has failed or failing, and you got a lot of fluid pulled up in your lungs, and then you have those symptoms like wheezing, difficulty in breathing, leg swelling, unable to lie flat, things like that. So that is not the asthma we're discussing today. The asthma we're discussing today is what we used to know as used to be known as bronchial asthma, which is asthma. Asthma is a respiratory disease, chest disease. And first and foremost, let's talk about what is the respiratory organs, at least the basic. The respiratory organ is the organ that is are the organs you need for your breathing. It helps you to take oxygen from the environment into the blood and take away unwanted carbon dioxide from the blood to the environment. And your respiratory system starts from your nose up to your pharynx, to your larynx, to your trachea, to your bronchi, and to your lungs. So this is your respiratory system. And asthma is a problem of this system. And it's usually due to what we refer to as bronchospasm. The spasm leads to the narrowing of the bronchi, which are the tubes that lead into the lungs. So when these tubes are narrowed temporarily, and is usually reversible, then what happens is that the tubes going into the lungs, the airways, become narrowed at that point in time. So when it's narrowed, it affects breathing, it affects the supply of oxygen and the removal of carbon dioxide. So this condition where there's temporary, reversible, long-term, chronic, incurable disease in which your airways are narrowed due to bronchospasm is known as asthma. So this is what is known as asthma. Like I said, it's long-term, it's incurable, and it's due to the narrowing of your tubes, which is caused by spasm of the bronchi. And like I said before, it is usually reversible. It is not a permanent damage or permanent narrowing. So it's like a spasm, and then when you treat it, the tubes will open again, the airways will open again, and then normal breathing proceeds, and then oxygen goes in and carbon dioxide goes out. So that's what asthma is. So it is a reversible condition and is very common. I will explain as I progress the symptoms, prevention, treatment, prognosis, how to diagnose it, what triggers them, what causes death in them, and then I will take questions. So I want to now talk about the epidemiology, how common it is. Asthma is very common. It can occur in children. Most of the cases of asthma start in childhood. especially the atopic asthma, where they have inherent genetic disposition towards having allergic conditions like asthma, eczema, hay fever, which we call allergic rhinitis. They all go hand in hand. So, and it's commoner in childhood, and in childhood is commoner in boys. It's actually 2 times as much in boys than in girls. We also have asthma that starts in adult stage. That one is commoner in women, and it has a worse prognosis than the one that starts in childhood. Also, asthma is commoner in developed world, thankfully, than developing world. And then in the developed world, it is commoner in the poor there, while in the developing world, asthma is commoner with the affluent. The richer people in the poorer nations have asthma. And asthma is commoner in the young. It's commoner in the young than other people. So these are some of the epidemiology, some of the little information you need to have about how common it is. So it can run in a family, and it's commoner in boys in childhood. So this is basically what asthma is and how common it is. So we're going to talk about, does it have a cause? What causes asthma? It is not quite understood, but there's a combination of both environmental and genetic factors that are responsible for asthma. So we basically talk about the risk factors, the cause, triggers, the things that trigger off asthma. These include things like allergens. Allergens are things that can cause inflammatory and allergic reactions, air pollutions, chemicals like carbon monoxide in the air, ammonia, methane, all those things in the air, irritants, cold air, sometimes due to exercise, certain occupation like hairdressers, timber workers, they are more liable to develop asthma because of the environment and things that they work with. And then chemicals like perfumes, even some medications. Some medications can trigger off asthma. Medications like aspirin, medications like anti-inflammatory that you take all the time, like ibuprofen, naproxen, diclofenac, Felvin, indomethacin, all those kind of medication, naproxen, can spark off asthma. And also, there are medications we call beta blockers, like propranolol, can also cause asthma. Obviously, family history, it can run in a family. So if a mother has it, or a parent has it, sometimes the children will develop it. And then also obesity puts you at risk of developing asthma. And there's another disease that we've discussed before in relation to ulcer, which we call gastroesophageal reflux disorder, where acid regurgitates from the stomach back into the gullet or esophagus. All these can lead to asthma. And then in pregnant women, smoking during pregnancy and immediately after birth have been linked with increased risk of asthma. So these are the risk factors to asthma. Nobody can tell you now that, okay, see what is causing asthma. And obviously some infections, some viral infections like rhinovirus and respiratory syncytial virus, there are viruses that cause upper respiratory tract infections, can put you at risk for developing asthma. So the next thing to discuss is, how do you diagnose asthma? How do you diagnose asthma? There is no blood test for asthma, and there's no radiological test you can say, oh, let me do this, and asthma can be confirmed. But to diagnose asthma, basically, number one, the symptoms. Asthma has symptoms, even though they're not peculiar to asthma, but these symptoms are one of the things that are suggestive that you may have asthma. I will mention the symptoms shortly. And then secondly, what we call reversibility, that if you have these symptoms and use the medication, the symptoms go. So if you have symptoms and use medications and the symptoms go, that is suggestive that it may be asthma. And there's something else we call peak flow meter, that is like a little tube that will blow in, and then you can check your ability to exhale, in there. And then the gold standard, which is still not 100%, is what we call spirometry, where you blow into a pipe for a long time and it measures your respiratory activity. So that's what we call spirometry. So these are the 4 things, but there are other tests that are neither here nor there, but they also help in the diagnosis. Something like chest X-ray, you can use it to see how your lungs are inflated. You can also do allergic tests to see whether you're allergic to certain things like dust and things that cause asthma. There's also the one we call nitric oxide test, So these are some of the tests, including provocative testing for exercise and cold-induced asthma. These are some of the tests that you can do. But basically, for you to diagnose asthma, it is the symptoms, then reversibility, and then you can use peak flow and spirometry. They are very simple investigations. They're not invasive. You can use it to confirm that you have asthma. So then, what are these symptoms that, if you have them, it could be suspected that you have asthma? What are the symptoms? Basically, the symptoms are not too many. So because of the bronchospasm, the tubes going into spasm, and then obviously there's an obstruction, what happens is that your chest feels so tight, like a band around your chest. You may be coughing and coughing and coughing, and then you wheeze. Wheezing is like whistling, that whistling sound, wheezing, especially when you're breathing out. And then you have problem with breathing, shortness of breath, you're struggling to catch your breath. And then finally, because of all these symptoms, your sleep is disturbed. So these are the basic symptoms that are attributable to asthma. It's not just asthma that can, show these symptoms, but if you have these symptoms, and perhaps you have eczema, or perhaps if your child has eczema, or has rhinic rhinitis, which we call hay fever, where you sneeze a lot, your nose is itching, your eye is itching, and then you have this symptom of cough, shortness of breath, wheezing, and chest tightness. Then you can, basically conclude, so to speak, that this child is asthmatic. So these are the symptoms of asthma. So let me see. And then obviously you also have other symptoms based on how severe the asthma is, because asthma, as it is, the symptoms and the severity vary. It can vary from one person to the other, and then it also depends on how bad your own asthma is. There are people whose asthma is quite mild. They just have occasional chest tightness, or occasional wheeze, and there are some people that they always have symptoms every day. They have these symptoms I talked about. They can't breathe. They can't even complete sentences. They're not going to be able to, in one breath, complete sentences without stopping. Their lips go blue, their hands go blue, and they're breathing very fast, and their heart rate is going fast. So, there are some people that their own is that severe, but I'm going to talk about asthma attack. So, and in discussing asthma, we have what we call acute asthma, and we have what we call chronic asthma. When we talk about acute asthma is like asthma attack, having these symptoms I mentioned, and suddenly after being all right for a while. So maybe you've been stable, for a couple of weeks, and suddenly you start having chest tightness, struggling to breathe, coughing, and wheezing, and it's not stopping by itself. So that's acute asthma. While chronic asthma is an ongoing asthma that you have, so the management, how to manage them differ. They differ how to manage acute or chronic asthma. Chronic is the long-term thing, while acute is you've been okay and then suddenly you start having those symptoms that you require immediate treatment. So that's what is acute and chronic asthma. And then in asthma, obviously, I need to talk about the prevention, but I'll come back into the complicated asthma, brittle asthma, the severity of asthma. But let me just talk about how do you prevent asthma first. Asthma hasn't got any prevention per se, but there are things you got to do to reduce your chances of developing asthmatic attack if you're already an asthmatic. You identify what your triggers are. Some people, their trigger is maybe cockroach or dust or perfume or smoke, or medication. So if you avoid all those things, lose weight. Weight loss helps in reducing your chances of having asthmatic attack. Obviously, avoiding very cold environments, because the symptoms of asthma are usually more common at night and cold weather. So you do that, and also you need to take vaccination. The vaccination that you require if you're asthmatic is flu, the one for influenza, and the one for pneumonia. So you need to take all those. They will help you to prevent you from having attacks often. So this is how to prevent attack. So we're going to also talk about the attacks of asthma. So we have what we call severe asthma, and then we have what we used to call status asthmaticus, which we now call severe acute asthma. So normally, if you do have these symptoms I mentioned, like chest tightness, wheezing, shortness of breath, and cough, you just take the inhaler, which I'm going to discuss. As soon as you use the inhaler, the symptoms may just resolve and you're back to normal. But there are some situations whereby even if you take the inhaler, as the more you use the inhaler, the worse you become. That if nothing is done quickly, it may lead to death. We used to call that condition status asthmaticus, but we now refer to it as severe acute asthma. There are also people that suffer from brittle asthma, in which they are always coming down with this acute asthma. Very often, you treat it today, next week they have this asthma. The other time they have this asthma. They keep having asthmatic attack. That's brittle asthma. These are the people that the asthma is really, really bad, that they need to be treated properly. I think the bulk of this lecture will be treatment and management. This is where we're going to spend time, and that's where people who are asthmatics probably are interested to know what to do to improve their situation. Okay. So, in this life-threatening asthma that I talked about, which is called, used to be called status asthmaticus, you have the same symptoms I mentioned before, but they are not responding to treatment. And then some people develop very life-threatening one where they're unconscious, or maybe they're exhausted, they're drowsy, their lips go blue, hand go blue, their blood pressure drops, they're not even able to breathe, and their chest is so silent, unlike in most asthmatic attack where you're but in this case their chest is so silent. Even if you use the stethoscope and listen, you will not hear anything. These are when the patient is almost if nothing is done, the patient is likely to die. So we will talk about the treatment, which is the bulk of the discussion, which is what I think most people who are asthmatic want to know, because one of in some discussions I've had with asthmatics in Nigeria, they tell me they're taking Ventolin tablet, they're taking this tablet, they're taking that tablet, and I say no, that's not the way to manage asthma. So in the management of asthma, we will need to, apart from obviously lifestyle modification, where you have to avoid all the triggers, lose weight, stop, avoid things, medications that cause asthma and things like that. But how is it treated? So, in discussing the treatment of asthma, we have the acute asthma, which is that sudden bout of breathlessness, wheeze, and all that you need to treat immediately. And then we have the long-term treatment, which you need to take to stop you from having attacks. So you need to be differentiating the two: treatment to stop you from having attacks, and treatment when you have attacks. The most important is treatment to stop you from having attacks, because if you stop having attacks, then you don't need to treat the attacks. So, okay, let's talk about if you have the attacks. How do you treat the attacks? I have one here. So if you do have attacks of, wheeziness, chest tightness, so this is the first line. The first line, this is not mine, I'm not asthmatic, but I have it here. So this is salbutamol, also known as Ventolin. They are called, they belong to a family called shock-acting beta adrenoceptor agonists, in short, SABA. So if you have asthmatic attack in any time and you have this, so what you need to do is to use this. This is salbutamol. There's another type you can use, which is terbutaline or colbricalin, but this is the commoner one that we use, salbutamol. Instead of people taking tablet when they have an attack, because if you take tablet, the tablet needs to get into your system, get digested before it starts working. But this one goes straight into your lungs. So you must, if you're an asthmatic, unless you have a problem with this, maybe side effects. If you're an asthmatic, you must have Ventolin, salbutamol, or Salamol, whatever it's called. But the salbutamol is the pharmacological name, but they can sell it as Salamol or Ventolin. So if you do have that attack, so what you need to do is to bring it out from the pack like that and shake it, because inhaler technique is important. Inhaler technique, because you might use this inhaler and you're not using it properly and you die while you're having this attack. So using it properly makes the difference. What's wrong with this stupid boy? So you bring us from sorry, I just had a call that interrupted me. You shake it. So before you use it, you need to breathe out first. And then you put this on you make a seal. Use your lip and make a seal. And then slowly, as you're slowly breathing in, you press. So within 30 to 60 seconds, you can have as much as 10 puffs. If you use one puff too, it didn't relieve, you can go on every 30 to 90 seconds, continue until you've had 10 puffs. Most likely, that would abort the attack and you'll be fine. So you don't do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No. 1, 2, like that. At least there's 30 seconds between puffs, but you can go as far as 10 puffs. I'm talking about acute asthma. So this is what we call in management of asthma, blue inhaler. So when you say, oh, have you got your blue inhaler? That's this. And it's also called reliever or rescue inhaler. So it's your lifesaver. You must have it. So it's only when you use this and it didn't work after going as far as 10 puffs, that it didn't work, that you may need another kind of inhaler, which we call a pratopium, which is we call it alpha blockers, a pratopium. So you can use it with this. After you can use it with this as inhaler like that, or you can use it in a nebulizer. A nebulizer is like a machine that can deliver this medication through your nose, because you have a face mask or cannula, and then you put it in light, power it, and then this medication is going into your nose, from your nose into your lungs directly. So salbutamol and ipratropium, if they don't work, then the condition is bad. So you may need to have intravenous steroids like hydrocortisone at this stage. And then if your chest has returned to normal, and then we may give you oral steroids like prednisolone to take for a short time to stop you from having relapses. So normally, if you have acute asthma, like wheezing, chest tightness, cough, shortness of breath, you use this. If it didn't work, you can use the pratopium or both of them in nebules, in that nebulizer, and it would work. If it doesn't work, you may need injections of hydrocortisone. I remember when I was in Nigeria, we used to use an injection called aminophylline. I remember when I was in teaching hospital, Port Harcourt, if you need to give that injection, oh my God, you have to be very careful, and you give it very slowly. And if you don't know that you have to give it slowly and give it very quickly, the patient can just die. So because of it, I know that they still use it in Nigeria, but here we don't use aminophylline again because of this. And there is no evidence that aminophylline works better than all these SABA, these relievers, the bronchodilators. There is no evidence that it works better, so we don't use aminophylline. So this is, if you do all this and you still having the attack and you're not responding to medication, that's what we call status asthmaticus. Used to call status asthmaticus. You will have to be rushed to hospital because you may need oxygen and other, steroid injections and everything, IV in the hospital before you can be all right. And there are some people that, with all that, they still don't get better. So there are some other complicated treatment, like what we call bronchial thermoplasty. I don't know what it is, and then immunological treatment that can be used to treat if you have gone through these normal stages of using your blue inhaler and your ipratropium. So this is the acute asthma. So obviously, we also treat whatever is caused. Sometimes chest infection may have exacerbated your asthma and made it serious like that. So you also be given antibiotics. But the mainstay of the management of your acute asthma is your blue inhaler, which is your reliever. It's only when that didn't work, you have to go to the next stage. So if you're asthmatic, please get this. Don't forget about the tablets, the Ventolin tablets. No, forget about them. Get the inhaler. If you are, let me just do something. I don't know how many of us here who are asthmatic. So the people who are asthmatic that are watching, that are asthmatic, if you have problem with them getting this inhaler, so let me know. When I'm coming back next time this year, God willing, I'll bring as much. I'll bring some for you. Okay. So this is for acute asthma. Let me explain it again. Acute asthma is when you've been stable for a while and suddenly you have an attack. So the treatment is different from keeping yourself safe from having an attack. Keeping yourself safe from having an attack is very important. It's only when you have attack that you use this. If you're not having an attack, you don't need to use your blue inhaler at all. You will just be gathering dust in your cupboard if you're able to prevent yourself from having attacks. All right, so let's go. How do you control asthma to keep yourself safe from having attacks? How? Okay, so it's like a stepwise treatment model, like a ladder. It goes from one stage to the other, from one stage to the other. First and foremost, for you to be said to be stable, that your asthma is stable, it means that you have not had an asthmatic attack up to 3 times in a week or more. So if you do have asthmatic attack or any of the symptoms up to 3 times in a week, your asthma is not stable. Or if asthma has woken you up at night, nocturnal symptoms, at least once a week, your asthma is not stable. So, or if you've had any other symptoms of asthma, be it cough, be it chest tightness, wheezing, shortness of breath, up to 3 times in a week, your asthma is not stable. So if you have this, then you need to be doing something. So if for once a week your asthma has woken you up at night, and then you have to use this up to 3 times a week, or in the night, then you have to be doing something else. So the first thing you need to do, if your asthma has woken you up at least once a week, or you've had any symptom or an attack up to 3 times in a week, is to go on what we call inhaled corticosteroid. Inhaled corticosteroid is another inhaler, but most of them are brown. It's not all of them are brown, but we have the one we call beclomethasone, which I think they sell it in Nigeria as Becotide. We also have fluticasone. You also have budesonide. These are corticosteroids, but the inhalers normally use 1 or 2 puffs twice a day. You don't have to have an attack. You're going to be using it to prevent you from having an attack. So we call them preventers or brown inhalers. The browns are like Cuva, Clenil, Becotide. These are steroid inhalers. You must be on them regularly, every day of your life. So this preventer stops you from having asthmatic attack. That's the idea. So this is low dose inhaled corticosteroids. You just take 1 or 2 puffs on a low dose twice a day. Because you use it as an inhaler, you don't tend to have the problems that long-term steroids cause. Even though it can cause thrush in the mouth, but we'll advise that when you use it, you rinse your mouth, so that you're not liable to thrush. I know it increases the risk of cataract in the eye, but it's not as bad as when you're taking the tablets. So it is advisable. So you must be on this brown inhaler that I call beclomethasone, budesonide, or fluticasone, any of them, which they're all available in the market, even in Nigeria. So you have to use it every day to prevent you from having an asthmatic attack that can kill you. So you're not using these inhaled corticosteroids to abort or cure an attack. you're using it to stop you from having an attack. Because asthma will never kill you unless you had an attack. So with this steroid you're using, you can live a normal life and you will not have an attack. So if you got that, it is not everybody that is using this steroid would also not have attack. You may still be using this inhaled corticosteroid and still you have attacks. You will not. You still wake up in the night. So what do? Even though, obviously, when you're like that, you now take your blue inhaler and you know, and then you're fine. So at this point in time, you need to do something else. I am not advising you to self-medicate, but I'm only giving you a background of what your doctor would do for you. If you're using this inhaled corticosteroid, this low-dose inhaled corticosteroid like fluticasone, budesonide, beclomethasone, which they market as Becotide or Cuva, Clenil, and all that, and you're still having to use your blue inhaler up to 3 times a week or have to wake up at night to use it, then you need to do something else. At this point in time, there are 2 things you can do. There's this medication that they call leukotriene antagonist, like example is montelukast. You can start taking that 10 milligram if you're an adult, or 5 milligram if you're a child, every night, 1 tablet a day. So if you use that, that's one thing you can do. Use that with on top of the inhaled steroid you're using. So there are 2. You're now using 2: the inhaled steroid and this tablet. Chances are that it will do the job and you'll be normal. Another thing you can do if you don't want to use the tablet is that you can use another different inhaler. 2 types or 2 in 1. But either it's 2 in 1 or 2 types must be what we call LABA. LABA is long-acting bronchodilators or adrenoceptor agonists. Examples are salmeterol, formoterol. But you cannot use it alone, because if you use them alone, it can cause a lot of adverse effects. So for you to use this, you must use them with inhaled corticosteroid together. So it's either you have 2 inhalers of one is salmeterol, one is fluticasone or budesonide, or you have a combination like Seretide, Symbicort. These inhalers contain 2 medications in them. So it contains this long-acting beta adrenoceptors agonist and also steroid in them. So instead of having 2 inhalers, if you use it, then use this one. You have that, and it contains the 2. So you're going to be using that 1 or 2 puffs twice a day for the rest of your life to stop you from having attacks. So what I'm explaining are the things you need to do to stop you from dying from asthma. That's why I said this topic today is asthma and asthma deaths. What you need to do to stop you from having asthma attack that can lead to death. Because you will not die from asthma if you didn't have attacks. If you don't have acute attacks, you will not die from asthma. You cannot just be, walking on the street and die from asthma. It's not a heart attack. It's not diabetes. It's not hypertension. It's not silent. You must have the symptoms to kill you. You must have that bronchospasm. The bronchi must, be obstructed and, constricted, and then for you to die. If not, you will never die. So what we're talking about is how to keep you alive if you're asthmatic. So I started with the first layer of preventer, which is the inhaled corticosteroid. If that didn't work, you can use the tablet on top of it, like Montelukast, or you want to use things like Symbicort or Seretide. That is not where it ends. If you're lucky, you can become asthma free and be living your normal life. But in certain circumstances, you will still not have your peace. You will still be having the asthmatic attacks in spite of the fact that you're taking this. So there's another step. You have to climb another step now. So what you can do at that point in time is you increase. I'm not saying you should do these things yourself because it's not as easy as this. So, but the steroid in your inhaler, the dose of it would have to be increased. You'll be using the same thing you were using, but your steroid dose has to increase. The higher the dose, the more likely to have side effects. But if you have to be alive, you have to increase the dose of your steroid. Your doctor will explain this, and then if this does the job, it's fine. Sometimes it won't still do the job. So the next stage is to increase it again to the highest level of steroid. So you're going stage by stage, and what happens is that you can step up or step down. So if after being on a high stage and then you notice that you're fine, you may decide to drop down your dose and see whether you're okay. So when you after increasing the steroid, let's say you didn't still get better, there's still hope. There are still things you can do. You can add medications we call tiotropium, or we call it Spiriva, which is like a capsule that you also inhale. Or there's a tablet called theophylline you can take. But the problem with that medication is that it requires monitoring. Or you may be prescribed oral steroid like prednisolone or dexamethasone. If all this don't work, then you will need to be you must be seeing your chest physician immediately, because that's a very terrible kind of asthma that you're suffering from. But most people, before they get to the stage of using theophylline, they have gotten themselves, and they're no longer having asthmatic attacks. So it is important, like I said, to differentiate between how you treat your asthma when you're having an asthmatic attack and how to keep you safe from having asthmatic attack at all, which is important, So throw away your salbutamol tablets and get your blue inhaler. This is what you will use whenever your chest is tight or you're wheezing. All right. So this is obviously, apart from that, if this don't work, I've told you there's immunological treatment, which is not available to you to go and buy over the counter. The specialist in hospital, who is a chest physician, would have to initiate it for you. I don't want to start calling names so that you don't go and start looking for where to buy them, and then when you have reaction, you say it's Dr. Chen that told you about it. So this is how you keep yourself safe. Let me recap it, because that is the fulcrum of this lecture. If you're having an asthmatic attack, you need your blue inhaler, to abort the attack. You can take up to 10 puffs when you're having that attack, and one puff at a time with 30 seconds in between. Otherwise, under normal circumstances, we expect you to use this maximum of 4 times in a day. But if you're finishing one in a month, then we know that your asthma is not being controlled properly. It's not being controlled properly. So when you do have that asthmatic attack, you need to use this inhaler. If it's not working for you, there's a pratopium inhaler which you can use. And then, there's some people that have problem of using this inhaler. They don't know how to use it, or they struggle to, do the respiratory movements that you have to do. You hold the breath and then blow it and then hold your breath a little bit. So people like that, we use what we call spacer device. It's like a tube. I don't have it here. I have it in the car where you just connect this thing and then breathe normal, So it's called spacer device, volumetric spacer device, or aero chamber. So you can use to deliver this. Or people use nebulizer, which is the machine. Then somebody said, I can't hear you again. Can you hear me, guys? Or am I talking to myself? Edward said, I can't hear you again. Is there a problem? Oh my God. What is going on? Have I lost signal? Okay, at least, can you hear me, guys? I can hear you, okay. So when you're not having an acute asthma, or you're not having an asthmatic attack, then you need to prevent these attacks from happening, and it is important that you know how to prevent it. You need to be on, as a first line, inhaled. When you mean inhaled, that's inhaler, and with steroid, things like Clenil, Cuva, Becotide, and then fluticasone. Use that every day. Low dose of it, 2 puffs twice a day, like 100 microgram, and then it's forever. So that keeps you away from having an attack. And then obviously, if that didn't work, then you have to move to the next stage, which I explained is just like step ladder. Because the idea in the management of asthma is you have to prevent the attacks so that you can stay alive. Because if you don't prevent the attacks, then that's where the problem is. It's not all the time that you can treat it and it's successful. And some, if you're in developing world, you might be having an attack. And I remember once when I was still a young doctor, I went to University of Port Harcourt. Those young boys runs. So we're in the female hostel, me and my friend, then Dr. Mekeze, who is a medical director of Toronto Hospital on the now. So we're just in the girls' hostel. I don't know, for some reasons, I had some hydrocortisone injection and aminophylline injection in my car. I don't even know why, and syringe and tourniquet. Tourniquet is what you tie to, And then a friend of mine, in fact, a very good friend of mine who's an asthmatic, who also came to Chase Bay with us, started having an asthmatic attack. And he didn't come with his Ventolin. And so what it means is that if I wasn't there, or in fact, I don't know. So they were just running around looking for where to get this Ventolin. So as they were doing that, I came out, with baby moves. So I had, there's a frenzy. I said, what's going on? They said, the guy was having an asthmatic attack. I had to rush to my car, brought the hydrocortisone injection, brought the aminophylline, brought tourniquet, brought the injection syringe, and administered, and he became normal immediately and continued with his babe moves. So the point is that if and that was in the night, how Choba Uniport in the night, what was going to happen to him? There was no, they wouldn't get, there would be no ambulance with paramedics to come to pick him. So what will happen? They will put him in a taxi before he gets to, and then teaching hospital used to be in town, not now that it's somewhere around the university. He would have died. So it is always important that if you're an asthmatic, you have this in your pocket, have it in your car, have it in your office, just have many, and just keep, because you don't know where maybe you're going to a place they're using perfume, or maybe there's dust mites, or somebody is smoking there, or Or something, or you may even take medication like aspirin without knowing, some ibuprofen, and then you start having an asthmatic attack, and you need this immediately. So you must have this to prevent death. It is called reliever or rescue inhaler. So that is for asthmatic attack. But prevention, you must be on steroid inhaler. It's not negotiable if you don't want to be having an attack and if you don't want to die. And if your steroid inhaler didn't work, you have to be on Montelukast, or you have to be on Symbicort, Seretide, all these kind of combination inhalers. And if that didn't work, then you have to be on a stronger steroid, like that, then, until such a time that your asthma becomes controlled. And like I said, your asthma is controlled when you have not woken up at least in a week with asthmatic attack, or when you have not had any symptom of asthma up to 3 times in a week, or if you have not had an attack that needed to be treated up to 3 times in a week. So that's the only time you say my asthma is controlled. But before then, you need to be on, you have to be quite proactive to make sure you prevent you from having attacks. Let me see whether there's anything else I want. Right. So, inhaler technique is very important. Like I said before, you have to know how to use the inhaler. Otherwise, it's not going to be effective for you. The way to use this inhaler is when you are having an attack and you want to use it, you bring it out from the box, from the packet like that, and shake it, remove the cover, breathe out, then you now put it in your mouth and make a seal and start breathing in. As you're breathing in, you release the puff. 1, 2, and then hold your breath for 30 seconds or as long as you can hold, and then breathe out slowly. But if you don't use it very well, some people just use it as if, no, you don't put it in your mouth like this, and no, you need to know the technique. And then, obviously, if you're having an asthmatic attack and this is not working, and you go to hospital, your doctor will need to assess you properly to make sure he or she knows how bad your asthma is. And how do we know how bad your asthmatic attack is? There are different severity of asthmatic attack. You can have moderate asthmatic attack, but you can have very severe one that if your doctor did not assess you properly, you are liable, you may risk death. So your doctor must, as a minimum, ask you to blow into your peak flow. That small thing you do, and to read and see how far your peak flow, because that gives it gives a good idea of your how bad your asthma is. That peak flow, I wish I had it. I used to have one. I don't know where. So that if that shows how hard you can breathe out. So your doctor must give you that, and then normally you have to stand up to do it. You don't sit down to do it, so that your respiratory effort will be maximized. You stand up, put it in your mouth, make a seal around it, and blow as fast as hard. You do it 3 times, and your doctor will take the best of 3. So normally everybody has the normal peak flow expected of their age and their height. So everybody, based on your age and your height, so you probably will say, okay, for this person, your peak flow is meant to be 500. That's what it is for a healthy person, for you, or for your height and your age and your sex, 500, for example. So when you're having that asthmatic attack, your doctor will ask you to blow, and then if, for example, is what you're blowing is 150, they will need to be rushing you to give you oxygen and do others quickly. But so that assessment of your peak flow, it is very important in determining the severity of the asthmatic attack you're having. And that thing your doctor must check if you're having asthmatic attack is your pulse rate, your pulse rate, and to see how fast it is. We know that normal pulse rate will expect maybe 50 to 100 maximum, or but obviously the physiological man is 72, but very few people are 72. Maybe people like us are 72, but it needs to be checked. And if it's above 110, some people are 110, 120, then so your heart rate is an indication of how bad your asthmatic attack is. So peak flow heart rate. Your doctor must also check your respiratory rate, how many times you're breathing in a minute. Because I don't expect you to breathe more than 12 to 16 times in a minute. Your normal breathing, your doctor will look at your chest and see how you're breathing. But in asthmatic attack, you may be breathing up to 25, what we call tachypnea, 25 times or more. So your heart rate, your respiratory rate, what you're blowing on the peak flow, and your ability to complete a sentence. You will just ask you a question, how are you? Where are you coming from? I can't. You will not be able to make a sentence. So if you're unable to make a sentence, that is an indication that your asthma is bad. Sometimes also, you can also go into respiratory distress, and from this asthma, and some of the symptoms, how to know signs will be your skin or your lips can go blue. That's what we call cyanosis. So if you're asthmatic and your lips are now going blue, then know that your oxygen level has dropped. You need oxygen. There's something we call, this part of the nose will be flaring up as you're breathing. We'll call it flaring of Ehlers nasal. So if that place is flaring up, is an evidence that you are struggling with your breathing. And also there's something we refer to as use of accessory muscles of respiration. So these muscles on your chest will start working hard, and then you may have depressions, what we call subcostal and intercostal recessions. These are some of the things that give an indication. And obviously, if things are so bad, your chest will be so silent. You will not even hear any noise in your chest if you're listening, or you may even be exhausted. You may start becoming unconscious and becoming drowsy. So these are some of the things that show that, man, this condition, you get a severe, and if something is not done, the person risk death. Up to 400,000 people die a year from this thing I just described, and that's not little, isn't it? And in fact, in the UK, as advanced as we are, up to 3 people die every day from these things I just explained. Up to 3 people die every year. So, but you can actually avert these deaths by doing the right things, avoiding the triggers. If you know that it's perfume, if you know that it's dust mites, if you know it's pollen, if you know there are medications that trigger off for you, or things you just avoid. Even if you have friends, it's your friend that causes you to have an asthma attack, avoid him or her. Even if not your babe, you leave them. Not be person where they're alive, they get babe. You know what I mean? I'm just joking. So, so if you try as much as possible to stay away from things that trigger off your attacks, that will help you a lot. And then obviously lose weight. And then I also want to mention it briefly. Some people have what we call exercise-induced asthma. Exercise is one of the things that trigger asthma. So, and so we always advise them that before they exercise, they should just use this blue inhaler, and then before they exercise, so that they'll be able to do their exercise. Let me see whether there's anything else that I'm forgetting. So like I said before, I just say childhood asthma has a better prognosis. Okay, I know some people have not looked at the questions, want to know, do people outgrow asthma? 50% of children who were diagnosed with asthma in childhood are found to, after about a decade, not have symptoms of asthma. You can say they've outgrown the asthma, even though some of them may develop it later at an older age, but they can go without symptoms for a long time, or they will not have symptoms again. So they can outgrow them. While people that develop asthma at adult stage, the prognosis is worse. They may suffer it for the rest of their life. You know, they suffer it for the rest of their life. Okay, so let me see whether there's anything else before I look at the questions. So maybe I'll have to look at the questions. Even though today seems a bit better, but it's still not encouraging. Still not encouraging. Let's see whether there's any question. Blessing, your question is chai, no data. I don't even know what to say to these people that come online and say no data. Why do you bother coming online to say no data? Do you want me to provide you with data while I'm online or what? Stupidity, honestly. The quality shirt now. Tochi's shirt now. Toe Nation. What's going on? How do I remove this thing? It's Toe Nation. We move. It is what it is. Let me see whether there are questions, Jerry. I'm going to sleep. I've got work tomorrow. So I am looking for questions, not people talking about the shirt or I don't know, maybe somehow I tend to miss the questions until I drop. But let me see. Most of the thank you. Yeah, the question, I keep seeing things about shirt and what have you. Ilo Lassi, asthma is a respiratory disease. I don't know whether that's a rhetoric question or is a question I'm meant to answer. Obviously, it is. It is. Where are the questions now? More common in boys than girls in childhood. Yes, Fola. Common among the affluent in the developing world. Yes, correct. Where are the questions now? Yes, smoking during pregnancy has been known to increase the risk of developing childhood asthma. Anthony Adesonia, yes. Meanwhile, all these people that my small beautiful sister gave airtime this evening. I've only seen one of them online. Don't worry, they'll have to refund the data. They have to refund the data. The whatever. Only one of them I saw briefly though. Noella, can it be genetically contracted, so to speak? It is not an infection that you contract, but it can run in a family. It can run in a family, yes. Especially childhood asthma. Oh, Adesanya, so you also stand on this table. People you gave Richard card didn't come. Don't worry. 419, they're different types. Where the question? Somebody asked me, is Ventolin inhaler a good drug for asthmatic patient? Really? But that's what I've been talking about since, and oh my God. I don't know. Sorry. It looks like we just... Oh my God. I can't access video. I don't know why. Follow, you're good you are good in summarizing. Thank you. Follow, you got me. What's the adverse effect of prolonged asthma with no major treatment? You die. Choose, but if you have asthma without treatment, the person will die. There are no two ways about it. You will die. How will you have asthma and not take treatment? How do you explain that? If your chest is tight, you're wheezing, you can't breathe, and you just don't take treatment. Oh, not that be that now. What can somebody take if you have asthma? That's what I've been talking about since. I want to know whether bronchitis is asthmatic. No, bronchitis is not asthma. Does asthma have prevention? You cannot prevent asthma, but you can stop yourself from having asthmatic attacks. You can stop having yourself from having asthmatic attacks, but there's nothing you can do to prevent you from developing asthma. So it hasn't got anything to prevent it, but you can prevent attacks. All right? Yeah, change of weather can trigger. Yeah, of course. Lola said inhaler doesn't work for me. It depends on the inhaler you're using. There are different types of inhalers. So if this one is not working, you have to keep going up and going up until you get the inhaler that works. There is nobody that inhaler doesn't work for. There is nobody, but maybe the type you're using. What's purple Ventolin drugs? I don't know what you mean. The tablets? Franol and aminophylline, Balogu. That's not the way we practice it these days. We avoid those medications these days. Bronchitis is just inflammation of the bronchi, which may be due to infection or due to viral, bacterial, or maybe due to things you inhale from the environment. But it is treatable, and you can just unless you're talking about chronic bronchitis. Chronic bronchitis is different. That chronic bronchitis and emphysema are what we refer to as chronic obstructive pulmonary disease, COPD. Or some people call it chronic obstructive airway disease, COAD. So Kelechi Samuel, maybe that's what you mean, where they cough and produce sputum and produce sputum and produce sputum, because in their own there's destruction, or the already destruction of some of the tubes in the airways. Unlike asthma, which is reversible, this one is not reversible. It's permanent progressive destruction. So that's chronic bronchitis. There's acute bronchitis, there's chronic bronchitis, which we don't call bronchitis these days. We just class it as COPD, chronic obstructive pulmonary disease. So that's a different thing, but it's similar. It's similar, you know. While COPD is usually common with people who have smoked for most of their life, or people who have been exposed to things like that, and but it's a permanent thing. It's a permanent destruction. While asthma is something that is reversible. If you have asthma and they give you inhaler and you feel better, that's asthma. Yeah. So, Fortune Hearts. Is there any help to use this Adesanya? I never told you I was a herbalist. Yes. Chinwe Sandra, thank you. Ifeanyi Blessing, thank you. I'll be my sister. Kedu? Ijoma, okay, is your daughter asthmatic? Bring back this video. I'm gonna save it here. I'm gonna save it on the platform. Yeah. Okay. Yes, Lolo, you must be using the inhaler wrongly, or you're not using the right inhaler. You need to see a doctor who knows what's up with management of asthma to give you the right combination of inhalers to use. There is no single person that inhalers don't work for. But you can talk about what inhaler, and there are different preparations of the inhaler. There are different ways that they are done. If, assuming this inhaler causes you to be coughing and all that, there are different, preparations and ways of administering inhalers that we have now to. Fola, about whether asthma goes away in the long run, I think I've answered it. I hope you saw where I said, or you heard when I said that childhood asthma usually after about 10 years resolve, about 50% of them, but they may have symptoms later in life. But but some people, it is what it is. That's why asthma is common in the young than adults. Older people means that it must have resolved with time. Adam, Waneri, my sister, my beautiful sister, thank you. The people you gave card data, I think I only saw Lolo. Others have gone to use the cards to call their boyfriends. Don't worry, I will get back to them. Jessica Joshua, thank you, thank you, thank you. Thank you, Adam. Thank you. Can pneumonia be mistaken for asthma? And what is the relationship between these two? Very, very good question, Fola. First and foremost, pneumonia can be a complication of asthma. But pneumonia is usually caused by infections, both viral, bacterial. And pneumonia is obviously inflammation of lung tissue. So the symptoms of pneumonia are different. Pneumonia is actually infection. So you may have symptoms like high temperature, you may cough out very, rusty sputum, you may even cough out blood. You may have pain when you're breathing. Like in asthma, children can have chest pain with their asthma attack, but normally you don't have chest pain. But with pneumonia, there's something we call pleurodynia, painful breathing. When you breathe, you can have that with pneumonia. Temperature, and you may become quite unwell, vomiting, nauseous, you may be drowsy and all that. But pneumonia is an infection, usually caused by an infection. Now, there are different types, even the ones that HIV causes, pneumocystic PCP, pneumocystic carinary pneumonia, very bad kind of pneumonia. So there are even fungal pneumonia. So there are different kinds of pneumonia, but pneumonia is an infection, which is an inflammation of the lung. Unlike asthma, which is not a disease, is not an infection. It is an inflammatory disease. which is reversible and is lifelong. And pneumonia can be cured and treated, and that's it. You can have pneumonia, they admit you, give you antibiotics, oral or injection, and your lungs are cleared and you're fine. But asthma, no, it's not curable. So I hope I've explained that difference between pneumonia. Mhm. Yes, asthma will never kill you unless you have an attack. Asthma will not kill you unless there's bronchospasm and you have complications. Complications of asthma, things like pneumonia, things like lung collapse, respiratory failure. From asthma, your lungs and your respiratory system can fail and you die, and things like that. But if you don't have all those attacks, no, nope, nope. Obum, thank you, my dear sister. Evelyn, it's better to be late than. Fluticasone salmeterol, that's serotype. It's not a gold standard. No, it's not a gold standard, but you can use it on the test stage. If the normal inhaled corticosteroid alone didn't work, then you can use montelukast, or you can use seretide or Symbicort. But it's not the gold standard. The gold standard is that you're going to use things like Becotide or Cuva Cleaning first. You can't jump to seretide. You can't. I don't know why you breathe. Are you Anthony? Are you obese? I don't know. Maybe if you're overweight, that may be the reason why you breathe like that. I don't know. Coryza, as in Obichuku. Coryza is like Qatar. That's what coryza is. Qatar. Runny nose. Coryza. That's all. So asthmatic attacks, Evelyn, uh, do not look like convulsions. No, it's not convulsion. Lolo, is it advisable to have a nebulizer? You can. It depends on how old that child is. That depends on how child is, because obviously it's scary. It's scary for the child, for you put in a machine and then put a mask on their face. You really need to hold that child down to be able to deliver the nebules, the inhaler, I mean the drugs, the medications, be it a salbutamol or a pratopium, into them. It depends on the age, but nebulizer is okay. As the Chisholm, there is no cure for asthma. So I don't know what you mean by permanent treatment. There is no cure, but it can be controlled. Christian Ike, can asthma be outgrown? I've answered the question. Is asthma hereditary? It can be hereditary, especially childhood asthma. So if there's no more question, there are no more questions, then it looks like there are no more questions. And instead of me reading, oh, my data is gone, my data is finished, I think I will have to call it a day, so that you can save your data and stop whining in my ear. Asthma. My dear. Oh Mama Kwachuku, please. What are they using rub for? Rub to cure asthma. Oh my God. Anyway, maybe that's homeopathic medicine. I don't know. It might be homeopathic medicine. But I don't see how. For actually, can asthmatic, yeah, I mean, like I said before, there are some people that exercise, triggers their own asthma. So depending on how bad the asthma is, if you do suffer from exercise-induced asthma, you can use your inhaler and then go in and do your sports ball, and then you can still do your sporting activities if your asthma is being controlled properly. Happiness, what was it? If if you have I understand your question. If you do have a asthmatic attack, you're told to not to lie down. You're told to sit up on a seat and get the room ventilated. But that may not cure the attack. You need an inhaler to stop the attack. Those sitting up is to prevent you from dying. I'm not saying that an attack, I mean, like any other thing, cannot stop spontaneously on its own. But obviously, it's scary if your chest is tight and you're wheezing and you can't breathe. And then instead of using your inhaler to abort the attack, you'll be opening door and fanning yourself. Who does that? You know. Betha Amanze, without your blue inhaler, these are your preventer, your reliever. Uh, and you're asthmatic. If you're an asthmatic and you do suffer from asthmatic attack and you don't have your blue inhaler, wherever you go, your life is at risk, I'm afraid. Your life is at risk. I'm sorry. Thank you, Siri, my brother, Kedu. Cyril, yes, asthma can be hereditary, yes. Oh, so I think I've gone through the whole questions. And then, so I want to rep this. Cedars, touches, beards. This is his trademark. So I'm his brand ambassador. I brought all the way from Lagos to the UK. I've got about 3 of it, and then the hooded one and everything. So at least if I go out and anybody asks, what is that? I would say, Toe Nation, we move. Mike Kelechi, what parents do? I don't understand the English. Can you rephrase? What parents do avoid the I did not understand the sentence. My friend Kelechi Mike. Mother to child, is it during, you cannot transfer asthma during childbirth. It is not an infection. Benjamin Monique, can pneumonia lead to asthma? No. Asthma can lead to pneumonia. Asthma can put you at risk of developing pneumonia. It's the other way around. Benita Ajoku, yes, adult onset asthma can start at old age, later age, 30s or 40s. It is possible, yes. It's called adult onset asthma. Michael, there is nothing parents can do to avoid their babies having asthma. The only thing we advise is that if a woman is pregnant and has a history of asthma, she should avoid maybe smoking during pregnancy and after delivery. But it is what it is. So, Lola Omuna, you're having you're cutting them a slack. People that collected data to watch this that didn't come. if they didn't have the network, at least they should be able to. I'll ask them to return the data now. Thank you, it's Vera Daniel. Tochi, thank you, Tochi, my daughter. Coryza in children is not okay. As in Obijuku, let me explain this to you. Coryza is just runny nose, all those catarrh symptoms. That's what coryza. But there's something we refer to as atopy, which is the genetic inherence to have allergic conditions. And there are three diseases, three conditions that are in one. Number one is this asthma. Number two is eczema. And number three is allergic rhinitis, what we call hay fever, where the person sneezes a lot, eyes itching, throat is itching. That's allergic rhinitis. So a child may have the three. So if a child will have asthma, eczema, and hay fever, this is what we call atopic kind of asthma. So if that's what you mean by coryza, yes. Chizob, yes, you can only use Ventolin if your asthma is just mild, and you don't have to wake up at night to use it, or you don't have a lot of symptoms like up to 3 times a week. You can only be on Ventolin, and that's fine. But if you're having more attacks, you will need to be on preventer, which is all these brown inhalers and tablets and all these things I talked about. No, Fola, inhalers are safe in pregnancy. It's safe. Inhalers are safe in pregnancy. Anthony asks, why do when you talk about bronchitis, you need to be clear the bronchitis you're talking about. If even if it's acute bronchitis you have and you're wheezing, the doctor can prescribe you blue inhaler to relieve that wheezing. It's not only asthmatics that use inhaler. People that have chronic obstructive airway disease also use inhalers. Okay? Betsy O'Malley, my friend. Yes, thank you. Uchoma, thank you. Cyril, I think I answered your questions. Maybe, I don't know whether you're not paying attention. This man's always asking about herbal concussion. Benjamin Moneke, if there is no first aid, if you're having an asthmatic attack, apart from sitting up and getting ventilation in, I still do not, it's not going to be a cure for emergency asthmatic attack. You need to have your medication at hand, please. So don't go. I'm not going to say to you, if you're having an attack and you don't have a medication, please find your way to where you can get medication, hospital, anywhere. Don't go opening window while you're no, the person may just die. The person may just die. No, Alexander him, there is no asthma in pregnancy. On its own, the person would have been an asthmatic before before she became pregnant. Tojuku, I don't know, but we don't prescribe Indian hemp in the UK here, so I don't know whether asthma, but obviously there is no cure for asthma. Tojuku, there is no cure for asthma. So if they said Indian hemp cured it, take that with a pinch of salt. So a pinch of salt, yes. So in a case whereby the asthmatic patient just coughed and died, yeah, coughing is one of the symptoms of asthmatic attack. The person was having an attack, and then because asthmatic attack is due to bronchospasm, the tube that takes air into your lungs is narrowed down and is blocked almost. That air is not going in properly and oxygen is not taken into the body and carbon dioxide is not taken out. So if you struggle to breathe and you're not getting enough oxygen, you suffer from what we call hypoxia. Or if you're not taking out carbon dioxide accumulates, you have hypercapnia and things like that, and these things can kill. Unfortunately, fortune. So if the obstruction is not relieved with the blue inhaler quickly, so that oxygen will pass and carbon dioxide will go out, and the person will breathe normally, then you run a risk of dying. Monique, none of your questions has been answered. I keep asking your questions and none of them has been answered. Okay. Yes, it's true. But you received card from Ada. You're here. You're full time. You and Lolo. Uh-huh. Yeah. Doris Ago. I said, are there asthma that comes and goes and also comes? But yeah, asthma is a reversible illness. You can have, so depending on how serious your own, you may have attack this year, have it 5 years time or 2 years time, 1 month time, like that. It comes and goes. It's not a disease you suffer every day, unless you suffer from what we call brittle asthma, where you have recurrent asthmatic attacks. Most people don't have recurrent asthmatic attacks unless you have that very bad asthma called brittle asthma. Mark Chukuma Obasi. If an asthmatic person is on the verge of death and he or she is not with the inhaler, what can one do? There's nothing to do to restore life. You need to have your inhaler or rush to hospital. There is nothing to tell you to do to restore life. So if you're an asthmatic, you must carry your blue inhaler all the time. You must carry your blue inhaler all the time. Doris Aga, I don't know. For you to I told you, for you to diagnose asthma, you have these symptoms that I explained: cough, wheeze, chest tightness, shortness of breath, and then if you use the blue inhaler and these symptoms reverse, that's diagnostic of asthma. Obviously, you have to also blow into the pipe, a small tube we call peak flow, and then eventually do what we call spirometry. And the spirometry estimates how your tubes are narrowed, and checking how much air you can breathe out after a deep breath and how fast you can breathe out. So it is important. You cannot diagnose asthma just by telling me that somebody has shortness of breath when they are at school with dust. It may be. Final question: what are the things not to do or avoid? If you're asthmatic, try and identify what your triggers are. What are the things that bring on your asthma? Avoid them. Avoid medications like aspirin. Avoid medications like ibuprofen, naproxen, indomethacin, felvin, cataflam. If you're asthmatic, please don't take them. Don't take beta blockers like propranolol. Don't take them because this would spark off asthmatic attack. Okay, if there are certain food that sparks off your asthma, or there are certain things like dust, pollen, chemicals, or if you work in certain places where there are a lot of dust and you have to leave those places. There are some people that things like perfume, ordinary perfume will spark off the attack. Then you just avoid being there when the people are spraying, or you use perfume that is not very strong, things like that. So these are the things you need to do to stop you from having an attack. premature babies, there's no relationship. But obviously, if your lungs are not mature, because obviously in prematurity, some of the chemicals, lecithin and all those things are not there. So they stand the risk of having respiratory diseases in future, premature children. But asthma is not linked to prematurity. Oh, thank you. Why isn't it, what's your problem with 29? You, when did you join? You're among the 29 versus 22K members. What's the problem? When did you join? Okay. So, what is the time? 9:42. We need to call it a day, guys. It is what it is. It is what it is. So, it is. Yes, that's my. It is what it is. This is my phone. So, it is what it is. So, yes. Good night, fellas. I have to go now. I will save the video. And for those that want to join in repping Toe Nation, it is what it is. It is what it is. Yeah? Okay. Good night, fellas. Thank you for watching. And God bless you. Bye.